Welcome to the Speaker Spotlight Series from the network of the National Library of Medicine, Region 6. I'm Nora Barnett, Health Professions Outreach Specialist, and I'm joined by my colleague Jacqueline Leskovic, who's going to be helping monitor the chat and take care of the technical side of things. Before we get started, a few housekeeping items. All attendees are automatically muted to cut down on background noise. If you have questions, please use the chat box. Select everyone from the to box to send a chat to all attendees. You can use the Q&A feature for technical questions. The session is being closed captioned and recorded. It will be available for viewing on the NNLM YouTube channel in a few weeks. A link will be provided at the end of the session to complete an evaluation and receive an MLA CE credit. Our guest speakers today are Celeste Montfortin and Jane Von Bergen, authors of On the Job, the untold story of worker centers and the new fight for wages, dignity, and health. Celeste Montfortin is the director of the Beyond OSHA project and a lecturer at Texas State University. A sought-after national media commentator, she lives in San Marcos, Texas. Jane Von Bergen is an award-winning reporter who covered labor for more than half of her 35 years at the Philadelphia Inquirer. She lives in Philadelphia. Miriam Jamil will be moderating. Miriam is a journalist with ProPublica, an investigative newsroom where she reports on labor issues and health equity. And with that, I'm going to turn it over to our guest speakers.
Hello, it is so good to be here with you all, and I'm really excited to get to ask Celeste and Jane questions about their awesome book. I have just kind of one opening question to ground us all in the same vocabulary and understanding for those who haven't had a chance yet to read the book and get familiar with this topic. If you can break down for us, what is a worker center? Jane, I'll ask you to lead us with that.
Well, thank you, and welcome everybody. It's great to be here. When we think about a worker center, it's really part of the labor movement. And the labor movement is most commonly associated with unions, but really it can be anything from two people complaining about their boss, at the water cooler, and then writing a letter or taking some action, up to a general strike in Paris that shuts down the subways. And so that's a continuum. And the worker centers are part of that because they're a group of workers who are getting together and taking action to improve their situation on the job or their situation for workers in general. But they do not have collective bargaining agreements like unions do.
And I would just add that when we did our research about worker centers, one of the common themes is that primarily these are immigrant workers. They have particularly vulnerable jobs, often low-wage jobs. There are many barriers that they face that can adversely affect their health and their well-being. So besides being low-wage jobs, there are usually language barriers. They have a commonality where, they have immigration status that, they may not be authorized to work here. There are issues of isolation. The kind of jobs that they are in don't lend themselves to forming a union because they are not in necessarily a particular industry. Workers who are domestic workers who, work in people's homes, day laborers who maybe those individuals you see waiting for work at the Home Depot or on a corner, waiting to be hired for a day's work. And so a variety of workers. Some worker centers do have members who tend to work in a particular industry. Like Jane and I visited locations across the country that represented poultry workers. Jane spent time in central New York with dairy workers. So it runs the gamut, but they are individuals who have a shared experience, primarily working to try to improve conditions at work that adversely affect themselves, their families, and their communities.
And can you give an example of how a worker center might come in and fill that gap for them when they have something that they'd like to improve, when workers need, a particular maybe assistance that would have been there with a collective bargaining agreement, but they're not in a situation where they have one, so they're turning to a worker center. What can the worker center provide?
Yeah. So, the worker centers, some are very large, some are very small, but they would have resources to help workers understand what their rights are. So many worker centers will help workers who have done their job, but haven't been paid for their work. So this comes up in particular with day laborers, where they get hired by someone to, do landscaping at someone's home or to do painting for a subcontractor, in some kind of building, and they're promised, $75 at the end of the day, but then they don't get it. And this is really there's an epidemic of this problem for day laborers. And so, through networks in their community, they will know or learn about a worker center, and they will initially go to the worker center to say, hey, I haven't been paid. Can you, help me get my money? And the worker centers kind of serve two functions. One is to provide that service and assistance. But what is important about worker centers is that they are not just a social service organization, because that's something that just bleeds an organization. If people are coming in and they just, want you to help them with their individual problem, that's not really building the capacity of those individuals or that community to try to get to the root of the problem. And so often in worker centers, and Jane can explain some of the specific examples, but there's often a reciprocity that occurs. So yes, we will help you with this issue of not being paid by this particular employer, but in exchange, you are going to provide some service and benefit to this organization. So it's one of the ways that they try to build community and try to build an organization of individuals who collectively are trying to improve conditions for everyone.
And one thing that's interesting is that the worker centers can also help workers strategize. Like, for example, in Chicago, Arise Chicago gave us an example of, suppose a couple workers come because they've been cheated, and let's just say it's a actual place of employment, like a garage or something, or a small factory. A couple workers show up, they feel like they've been cheated out of overtime. So then they say, okay, go back and see if anybody else is angry about this, has had the same problem, and they draw people in that way. Maybe another group of people are worried about a health and safety issue. There's no lockout, no tag out sign on a machine, so they think they have to fix it when the machine is running, and they gather a group of issues and workers together. Then the next step after that is alliances within the community. So Chicago labor unions are very connected to organizations of faith. And sometimes those organizations of faith can apply pressure. So the pressure to resolve the issue comes from the workers to start, with them agreeing and kind of picking up the problem, and then and resolving to resolve it, but then tapping into networks that the worker centers have developed in the larger community. And that's the point. The worker center is not in isolation. It's in a community of faith people, of academics, of lawyers, of various other civically minded citizens.
Cool. Now, what do worker centers have to do with public health? Celeste, I'll start with you.
So they have everything to do with public health, because we know that the vast majority of our waking hours is spent at work. And so there are many In my field of occupational environmental health, we talk about hazards, but we can talk about conditions of work that can either adversely affect people's health or can enhance people's health. And so things like wages, benefits, the hazard, the chemical or safety hazards in the workplace, having some control over the way your work is done, the pace of your work, being respected at work. And so we think about social determinants of health. Those are all factors that can affect your well-being. And worker centers, we find, take a very holistic approach when they're thinking about addressing issues. And it's really important to recognize with worker centers that the issues that the worker centers campaigns or initiatives are focused on are things that the workers care about. And we found a really interesting, example in New Jersey with a worker center called New Labor. The leadership, which was an academic and a labor organizer, they saw a need in their community with a lot of day laborers, and they kind of had
and temp workers, temp agencies.
Right, temp workers, and they had a vision of what these workers needed. They were presuming they knew what these workers needed. And so, but then when they started to have conversations with the workers, it wasn't about having a revolution in their workplace and forming a union. The very first thing the workers wanted was they wanted English lessons, and they wanted to learn how to, basic skills on a computer. And so the workers, the worker centers, the leadership, the board of directors, the organizers, this is modeled on meeting people where they are. And when we think about like language barriers, you can definitely see how that can affect people's health, and if we talk about it at work, if you can't express a concern about, a physical hazard at work, or you can't talk to your supervisor about something that's wrong at work, or the OSHA training that's provided is not in a language that you understand. We saw this so much during COVID. It was unbelievable to hear from workers about what was going on in the workplace, communicating information in English when the workers speak Vietnamese or Spanish. And so, there's so many ways that we can think about what happens in a workplace and how it affects people's health.
And can I add to that too, that it gets very specific. Like at the New Labor Center, I was there the day that they had a training about worker safety, and they made a list. A bunch of the workers were restaurant workers, and they made a specific list. Like, how in a restaurant there's that door that opens up and back and forth between the kitchen and the dining area. Well, that's a place where it opens and the person on the other side is hit, and then things fall and everyone's burned. And so and they chart out these things. I saw in Bryan, Texas, where they had actually made a complete schematic of a chicken poultry processing factory floor and made like marks where the hazards are. So they get very specific on worker training and safety, ways to improve. But there's another thing, it's leverage. So when you talk about like workers being upset because of some injustice at work, they usually, if they're not being paid, probably there's something else wrong too. I mean, it's just kind of, if you have a sort of low life organization, that's gonna be everywhere. So what they might do is they might find out they're gonna work together to reach out to various government agencies, and one of the agencies they will definitely reach out to is OSHA. That's a good way to scare an employer. They don't want to have any government people around. So worker health and safety comes in all sorts of things. And this is the last thing I'll say, and then I'll shut up. There's one like really good worker center. I didn't get to go, but Celeste did, because she's the lucky one. No, Celeste got to go, and it was a street level health. And that one actually started as a just with a pickup truck, a bunch of little meals and styrofoam like scrambled eggs, and a nurse who came around and bandaged people's hand injuries and looked at their and talked to them. And that's how it began. Mostly health is not the entry, mostly wage theft is, but in that case it started as a health organization and moved on from there.
Yeah, that was a super interesting one, because it was nurses and physicians who wanted to do something in the community, and they knew the day laborers, many day laborers, look for jobs. It was in Oakland, California. And they wanted to provide clinic services, and like Jane said, for acute injuries, but also people who have diabetes, different types of health problems. And that was another example where they were very motivated to start this health clinic. When they talked to the day laborers about what they wanted, is they said, we want better jobs, and it's, again, you think about the kind of work you do, the quality of the work that you have affects your health so much. And, and because these health professionals were very, very interested in serving the needs of the community, they said, we need to do both. This is what, the workers want. Some of them need help with, immigration issues, or in California, there are opportunities for, whether you're documented or not, to get health insurance, or connecting them with a free clinic. But all along the way, building community, having events so they come together. They coordinate with food banks, and they provide meals twice a day, and not just, like peanut butter and jelly sandwiches. I was there, and it was like amazing, beautiful food. The space that they had, had a professional, kitchen. And I remember the back of the pickup truck when we would go in the morning, and they would provide breakfast. And again, it wasn't just a peanut butter and jelly sandwich. It was this beautiful carton, kind of, we used to get those old, like in kind of classic Chinese food restaurants, a little, carton, but it had huevos y arroz, eggs and rice. And they had this beautiful box of plums just balanced on the side of the truck. And, the men were listening about some health and safety issues, about using ladders and working in the heat, but at the same time they were grabbing, these lovely plums. And it just was such respect and care for these workers, and treating them with respect and dignity. And just a beautiful thing.
Wow, thank you for those examples and those points. It sounds like that worker center and so many of these are bringing a lot of just like dignity to these jobs, which is so much more important than we usually talk about. Jane, you mentioned OSHA and working to reach out to OSHA, and how that sometimes can have an impact on an employer, because maybe the employer will be intimidated into changing their behavior, or other things can happen. I was curious also about the role of OSHA in all of this, because like for some of these problems that you're talking about, for some of the safety and health issues that workers might want to improve, there are already, policies in place that are restricting, the dangers that workers are talking about, or there's at least guidelines on how to improve a workplace on those particular topics that workers are having problems with, but they're still happening, and workers are having to either like survive through what's going on, if they can survive, or organize through these worker centers. And I was wondering if you could talk about why that is.
You know what? I'm going to pass that right off to Queen Celeste, because she has much more experience with OSHA than I do.
So it's interesting using for the worker centers to use OSHA as a strategy because Jane knows this and Miriam knows this as well, doing her reporting both at the Center for Public Integrity and for ProPublica, that we as insiders know that OSHA is not all powerful. It probably isn't something that employers should really be worried about, right? Because we know with OSHA's funding and the number of inspectors they have, it would take like 157 years for every workplace to get inspected just once. But, that's the reality. The other reality is there is fear by employers, just the threat of having OSHA come. And so, the worker centers and workers themselves in worker centers, they recognize the limitations that OSHA has, that yes, there are some standards, but you have to get OSHA in there to do an inspection. And then there are things that the worker centers are concerned about that OSHA doesn't have standards for, or that their policies are really not effective in taking care of the problem. So for example, in a worker center in Bryan, Texas, the issue that the workers were most concerned about, and the issue that was their very first big public initiative, had to do with not getting access to the bathroom when you have to go. And this is all related to how fast the lines go. About 140 birds per minute of chicken carcasses go on this assembly line. It's really a disassembly line because the workers are then, maybe I'm the one that cuts off the wing and Jane's the one that, cuts off the breast meat or whatever. So that's going very, very fast. And the company, it's called Sanderson Farms, they want the workers to use the bathroom when it's lunchtime. And the women say, you ever have like the lunch bell ring and then everyone goes to the bathroom? What do we know? There's a huge line there. And by the time you take off, your smock and the coat underneath, it takes too long. So, and we all know that not all bladders are created equal, that sometimes you don't just have to go at lunchtime. You have other times that you need to go to the bathroom. But because these lines go so quickly, and there aren't any extra people roaming around, if you want to go first, you have to try to get like a supervisor's attention. And maybe that can happen. Often workers will say, well, it's like a half an hour before they let me go. There are workers, including men, who were very embarrassed to say that they wore adult diapers on the assembly line. And there's also like an interpersonal issue that happens. Like if I'm the worker who has to go and finally, my supervisor says, okay, you can go, but hurry back. When I step away from the line, that means that Jane and Miriam and Joe and Stan that are all have to make up the difference for me working. And then the workers say that then the chickens pile up, they file on the floor, then we get in trouble because the chickens are on the floor. And you, as the worker who has to go to the bathroom, you might say, you know what, I think I'm just going to hold it because I'm going to put my coworkers in a situation where they have to work that much faster. And so this was the campaign that the workers wanted to engage in. But OSHA oftentimes isn't going to just show up when their complaint is about the bathrooms. Normally what happens, unless it's like a really serious hazard where people are at risk of, losing their lives, like scaffolding is not appropriate and, the workers are going to fall. Mostly what OSHA is going to do with that kind of concern raised by workers, if workers actually send in a complaint, is OSHA will call that workplace. They'll call that plant in Bryan, Texas, and they'll ask to speak to the supervisor, and they'll say, we've received a complaint from workers about not having access to the bathroom. Can you tell us about that? And management will say, well, that's not a problem. Of course, we would always let workers go to the bathroom. And even when you speak to their corporate offices, they'd be like, oh, that would never happen. They, I can't even believe people would accuse us of that. That's so undignified. And when you say, well, workers say they have to wear, diapers on the line, they say, oh, no, that would never happen. So it's like, what's OSHA supposed to do? The company says this, the workers say that. Unless we're in there in the plant that actually standing watching a worker trying to go to the bathroom, we can't prove that. And what workers say is the best day to be at work, the very best day is the day when OSHA is there, because it's nothing like the other days that they are there. Right? Well, and I'll add one other thing about the bathroom. So when the workers decided that they were going to really focus on this, their first public action, along with some Episcopal priest, and I think there was like a deacon from the Catholic Church, they, and I happened to be there, they stood outside the plant. They wanted to be there when the morning shift of workers was coming in. So there were people from the community supporting, there were some students from Texas A&M, and there were some former workers and family members of workers. And we all stood there with diapers on and signs that said, let our people pee. I mean, a lot of the signs were in Spanish. And as the workers were driving into the plant, they saw people there supporting them, recognizing, that this is a problem. Some of them you could just imagine coming in and they were like filming with their cameras, but some people just like didn't want to look, make eye contact. There were some chicken trucks coming in, like big 18-wheelers with like all those chickens. And, you got like a honk from the big like 18-wheeler truck, got on the local news, which is what they really wanted, to get attention. Because this is a major employer in their plant. And the workers were so proud and heard from workers inside the plant. And I think Jane actually did an interview with a gentleman whose wife worked in the plant. I think maybe they had both worked in the plant, but the wife said, things were great after that. They let us use the bathroom. I had a supervisor come and ask me if I needed to use the restroom. So, I mean, that was kind of short-lived. That happened maybe for a couple of weeks. It hasn't resolved the total problem. But yeah, so that's kind of the dynamic that goes on. But it's very exciting to see these campaigns roll out.
And in the dairy hands, in the case of the dairy hands, the worker center sort of discovered something. Is it a local emphasis program? Is that what it's called, Celeste? Yeah. So they discovered the local emphasis program, and they wanted to do a local emphasis program for dairy farms to specifically look at health and safety issues having to do with the fact that cows are 1,000 pounds, the fact that the mother cows understandably get a little bit annoyed when their calves are taken from them at birth, and other issues like sort of slippery piles of manure and silage. So that they did eventually, even the fact that they were kind of maneuvering to get that program, they said made a difference at the farms.
Wow, those are really, were you going to say something else, Jane?
No, I'm good. I'm saying, wow, you asked that one question and we just went on. But
you can tell we learned so much and we're just so excited to share this movement. It really is an untold story. And, and I think that was, part of my motivation is there's been so much depressing news about like workplaces and, just, a lot of things over the last few years. And at the same time, there was, these wonderful things going on in unsuspecting places. This isn't just Chicago or Boston. This is St. Cloud, Minnesota and Grayton, California, places that I would not have expected you would have this kind of organizing going on with extremely under-resourced organizations.
How under-resourced? The Bryan people were selling tortillas once a month that they made to make the rent. And guess where their headquarters was? It was the back room of a beauty parlor and in a strip shopping center. And let me just say that this was among the most modest of strip shopping centers. Like, it was barely that, and then finally they moved up in the world and they got the whole beauty parlor. The beauty parlor moved out, and just exactly at that time, the library was getting rid of its furniture. I guess it was upgrading, so they borrowed the furniture. But that's how, when you talk about under-resourced and you have to sell tortillas to make the rent, that definitely qualifies as under-resourced.
It is for us, I mean, just so inspiring to think about some of the most vulnerable workers in our country with language barriers, with concerns about deportation, for themselves or family members, and finding this sense of community and learning about what their rights are and taking action, strategizing, really developing the leadership skills. Like, I'm not sure, family members or my own students, despite our need to do those things, might be fearful about getting together and talking about work and going and protesting. So, it's really just amazing to think about it. And as worker centers learn about what other worker centers are doing, they build knowledge from each other. And one of the things that Jane and I focused on in a couple chapters of the book are campaigns that worker centers are engaged in at the local level, the state level. And as one worker center, has success with changing a law in New Jersey, then other worker centers who have, their members have those same issues, they're like, wow, they did that. Let's try to do this where we are. And we're talking multi-year, initiatives. Do this in our town or in our state, but we're going to do it a little better. And we saw that transpiring, over a 10-year period of each worker center building, learning from each other and getting a little bit more from what their colleagues were able to accomplish in another place.
Thank you both for all of these examples. I think this has really kind of brought many of your points home, and it's really beautiful and also just terrible to hear some of the realities that you found. Like, that was very striking. A question about kind of the recent health situation that we've been in. How were worker centers affected by COVID-19?
Well, prior to writing this book, I have been doing work with poultry and meatpacking workers. And so I already, was familiar with the musculoskeletal hazards that they face in the plants, just the repetitive motion, the lifting, getting carpal tunnel syndrome. So I knew about that. There were chemical exposures in these plants, the bathroom issues in the plants. And so we already knew the situation was bad. And then when COVID struck and meat and poultry and some other industries were considered, essential industries, those workers had to continue going to work. They stand very close together, shoulder to shoulder. So no social distancing. They were not provided with any kind of mask, so workers were bringing in their own masks. And early in the pandemic, companies did not want them wearing those masks because they thought it would make the public feel that it wasn't safe in those plants. And so, it just kind of spiraled out of control after that, because then we had some of the worst outbreaks across the country were in counties that had meatpacking, poultry, or prisons. And so you had workers who, were developing COVID, were then afraid of getting COVID from coworkers who did not have paid sick leave and therefore continued to come to work. We have the whole issue of COVID of asymptomatic individuals. Imagine having COVID, not wanting to reveal that because you don't have paid leave. Then the plants started losing employees because they were out sick. And then there was great fear because workers had, coworkers who were missing, not there, but you didn't know if they were missing because they were taking care of a loved one. Did they have COVID? And now am I exposed? So it was just a cascade of problems. And it seemed like it just, early in the pandemic, from week to week, it was some other problem that occurred. And again, they were designated this category of essential workers. So even if companies were to decide, we need to scale back production because, we need to do social distancing, there was kind of an unstated agreement between the White House and the industry that, we don't want you to take a financial hit. And so therefore, we are expecting production to be the same. There was this great fear that there would be empty shelves. You couldn't get your chicken anymore, get your meat anymore. And I think what we saw in so many industries is industries just shifted. You realize we're going to have people working at home. We as consumers realize, I'm not going to be able to get Cheerios every week or, whatever. But there was this expectation and kind of a mandate that there aren't going to be any shortages of meat on the shelves. And so there was this, companies were encouraged to keep doing what they were, always doing.
And one thing I think of when we're just talking about what the worker centers themselves did, they ran food drives, they ran protests. There was one strike that was called almost immediately outside of Chicago, and it had to do with not having protective gear given to workers. So the worker centers did immediately mobilize, and they were able to do it quite nimbly because of their they don't have the hierarchy that a lot of other organizations have. So that's what they did immediately. Can I say one thing here that doesn't have to do with exactly with COVID, but has to do with line speed? This is something that struck me after we finished the book. As we write, we talk about these workers like immigrants, people with, low wage jobs, but the issue of line speed is an issue that affects all workers, like librarians, like social workers, like journalists. It's a matter of quote line speed. When you have a nurse who has too many patients, when you have a social worker who's supposed to take care of kids but has a file this high on his or her desk, when you have librarians that have too many research questions to answer or too many papers to process. This is a line speed issue. So I think it's really important that we don't see these people as other people, especially, college educated folks like most people probably are in this organization or group. This issue of line speed that is preventing people from going to the bathroom in the chicken plant is the same issue of quote line speed that's keeping you working late, not seeing your children. And as a society, we need to deal with this. And carpal tunnel syndrome, how many, Miriam, I'm sure many reporters who have shoulder and arm and neck problems. The Inquirer newsroom was like full of them. So line speed matters, and it's something we have to consider as a society. It's a health issue.
Thank you both for that. Thinking about social determinants of health, what is different about worker centers compared to unions?
Jane, I'm gonna.
Well, I think we're going to have to say what is different from worker centers and unions, not just in the field of health. But one thing that unions have that's real, that worker centers don't have unless they have someone like Celeste to be a friend of them, like Celeste is, unions many of them have health and safety experts on staff. One thing I think most people don't realize about unions is they think, oh, unions strike, or they, whatever images they have of unions, pickets. They don't realize that unions have a large back office of experts, and most unions have a health and safety expert. So experts who are able to look at the issues. Look at the United Mine Workers. I mean, that would be an example of, maybe not perfect, not always great, but at least there's some expertise there. In Philly, the brick workers were really big in helping out with silica, and they had the knowledge. That's the point. They have the knowledge in-house. They can afford to pay somebody to do that across the national organization. Mm-hmm. So that's like, is that what you're asking, Miriam?
Yeah.
I think also that worker centers, in contrast to unions, may be more responsive to health and safety or to social determinants of health, because it's the concerns are really guided from the ground up of what the workers say they want to address, where unions will tend to focus on, a more limited number of issues. They look at wages.
Well, the big issues. I mean, across every single person is going to care about wages, even, and maybe half the group can get to the bathroom on time. So it's a unifying issue, wages and benefits. But worker centers may have a smaller audience, so they'll be able to focus as less.
Right. And I do think, what I hear from workers sometimes is if the employer and the union are in the period of trying to negotiate a contract, sometimes that's an issue that the union will want to bring up, health and safety problems as part of, the smorgasbord of issues they want to talk about. But there are other times where the union doesn't want to make hay about issues, and that can be frustrating to workers. And one of the worker centers, the employer they work for, at their workplace, they do have a union, but the worker center does not feel that the union is responsive to the needs that the workers have. And so there's interesting tension. It's different. Different worker centers have different relationships with unions, but I think it can go both ways in terms of, the health and safety issues, or the health, the determinants of health issues that unions address, or that, that worker centers address. And again, every worker center is different, that we experience that.
That's super interesting. I think that's sometimes also why unionized workers will come to journalists, because it's like I often hear them say, like, yeah, we raise this issue to our union, but it's not a priority, or they don't want to rock the boat over this particular. Yeah. I want to sneak in one more question before we open the floor for attendees to ask what they would like. So attendees, please be thinking about questions you'd like to ask to Jane and Celeste. What do you see as the future of worker centers? Like, are they here for the long run? Are they more of a Band-Aid? Yeah, what do you think?
I think worker centers are going to continue to grow. I see them as a really important part of the labor movement, and that we think of the labor movement, we shouldn't just think about unions, because we have so many different types of employment now that don't fit in the union model. We also know that there has been significant degradation in our labor protection laws, like adverse decisions by the NLRB. There are many examples of employers being very organized in terms of trying to prevent workers from forming unions. So unions certainly still have a place, but we know that less than 10% of private sector employees in the US are members of unions. And I think that worker centers are another type of organization. You're not going to get a collective bargaining agreement, but there are other strategies that worker centers have experimented with and succeeded at making change. And I think that there are opportunities, and it's just going to take people knowing more about worker centers and having different kinds of worker centers in different places. So I definitely think it's an exciting time, because I think about, like, even for my students that work in a lot of restaurants in our college town, I'm like, you guys need to get together and figure out how to improve things. It's not going to just happen miraculously, and you're never going to get a union at that, at that restaurant. But you do have power. You do, as Jane said, we have labor laws that allow workers to get together, to talk about conditions of work, and to have those discussions. You can't be retaliated against. Not that you might not be retaliated against, but there are laws to at least allow workers to come together and talk about conditions at work.
Great, thank you. I think attendees are still thinking about their questions, but we had a few come in from one of our team members on here. Have any employers reached out to worker centers or to any of you, or to the two of you, for assistance when issues are identified? Like, have you seen moments of like collaboration? Like
employers reaching out to the worker centers?
Yeah, I think that's the question.
Mm-hmm. Did you hear any examples of?
No, I haven't heard of that. I think, I mean, wouldn't that be intelligent to do? Nothing like, what do they say? Keep your enemies close, or not that they're your enemies, but that would be a smart thing to do. But no one has reached out to the worker centers that I know of.
I guess one, maybe something that maybe fits in that category is the Worker Center in Grayton, California runs a hiring hall. And so this is in Sonoma County, so very fancy kind of place with a lot of vineyards around. And this particular town, people in the town, they didn't like workers, day laborers, just kind of hanging on the street waiting for someone to pick them up to do a painting job or landscaping. And so in the town, through some, of the, community leaders and faith people, supported the development of this worker center, which I think has been there for about 20 years. And, the system that they have now is that the day laborers do not wait like just on the town square. There is this beautiful building. And they go and wait there for jobs. There's a super organized system. When they get there, their name gets recorded on this board, and employers simultaneously have contacted the worker center and said, I need 2 workers for a couple of days to help me move out this old furniture, into my garage. And so the worker center will match up this employer with the workers that they need. They will make sure that the workers that they match up have the skills to do that. The employer signs a contract, agrees to pay a wage that is fair, and the wages are decided by the workers. So they get together once a year and they decide, and this includes domestic workers who are doing house cleaning, for regular house cleaning, it has to be, $14 an hour. And it's usually slightly higher than the state of California's minimum wage. And in exchange, that employer makes sure, they're getting someone who has the skills, who is going to show up on time. And if it's a more challenging kind of job, if it's something they're going to be using chainsaws, and, you want someone who knows how to use a chainsaw, the price will be a little bit more. So in that case, in that town, it's really recognized as this is the way that a homeowner or a contractor can get those extra hands, that, the extra people they need to do that job. And that the employers recognize that this is, an appropriate way, a fair way to hire people for, a short-term job. So in that way, I think it's a really good example of a direct service to the community. And in that case, they do that worker center, they do more policy work at the state level, on minimum wage and, worker rights and things like that, but they don't do so much things as like a protest against employers. So employers in that situation aren't really the target of action.
Interesting. That's really cool. We have one of those close to where I live in Maryland as well. Question in the chat from attendee Gregory. Thank you for your question. Gregory's asking, have you encountered any examples of librarians working with worker centers?
Ooh.
And if not, how can librarians support worker centers?
Oh, that's a great question. Now, there are about 225 worker centers around the country. But I definitely could see a collaboration between a worker center and a library, in multiple capacities. I know libraries often host community events. And so you could have, worker centers, representative workers come and speak about that, tell them about their work, the domestic workers or day laborers. I think of libraries as a place for an educated public and for people who are, curious about things in their communities. But
and
I also think
that, and we might even come.
We would come, right? But I also think librarians, they can learn about worker centers, but worker centers might also need assistance, legal research or, any kind of research.
Health and safety research, like that in the poultry plants, I don't even actually know exactly what it is, but there's some kind of chemical cleaner that is used. And I saw when I went to Brian, I saw like all these hands with arms with, really bad like skin irritation. So to help them find out what those chemicals are and what the effects of those chemicals might be, that would be something that could really be useful. The other thing is that there's research. Part of the strategy for public policy change involves research. Typically, the research is done by academicians, but there's no reason why the research couldn't be done by librarians as well. And that would involve like just understanding, like I said, the chemicals or some of the other nature of the job. So your research abilities are awesome and useful, I think.
Yeah, no, that's a great point. We found that, the partnerships between worker centers and academics in some places is very strong. And I definitely view librarians as part of that. And again, all these relationships are reciprocal. So it's not just worker centers trying to get something from someone else. There's an expectation that, there's contribution and assistance on both sides, that it's a mutually beneficial relationship.
Yeah, for academics, for example, I mean, they get published or they publish some report about working conditions. They get their names maybe in the newspaper. It enhances their status at their university. And I would think it would do the same, the same for librarians. So that'd be cool.
That would be. That's a great idea. I never thought of that.
That's really exciting to think about. It's so hard to often like actually access information on like what the rules are, what all these
right. Rules are great.
Yeah. And I think that's how I connected with some worker centers, is they reached out to me. Like, we have this problem, can you help us, not help them physically with the problem, but like, what are the rules and what do they do in other places? Are there examples? And so it's kind of that technical assistance. And I just think thank you, Gregory, because I hadn't thought about that. But, every town has a library. And I mean, I guess it would be up to you all because you have your own responsibilities and things like that. I don't know. I'd like a webinar on like everything about librarians. Miriam, I don't know if there are other questions, but if there aren't, I'd like to ask you a question.
Sure. I'm supposed to hand this over to Nora, who is helping set this up at 55, which is now. So I don't know if we have time for it, but maybe you can answer in 20 seconds.
Well, Miriam has done all of her own like amazing reporting on many issues, but particularly, also on workers. And I'm wondering, you did an excellent series about Central Americans and people from Mexico migrating here to the U.S. for jobs. And I don't know if it was the Bestia was the name of the train that that was kind of part of the story that you did. And I'm just wondering, like, with your whole story and your reporting on people who are actually coming here, and Jane and I are writing about some people who are here now who may have had that path to get to the US. Like, do you see any of those individuals like, being interested in being part of worker centers? How do you see that connecting with that migration story?
Yeah, no, well, thank you for reading and asking. I think, there's such a diversity of people who are, migrating and seeking work here. And I think like worker centers have been such a key resource for folks who are like you were talking about, like that they're not in jobs that are unionized. They're like, there are many things working against them as far as like knowing their rights, asking for their rights, actually having their like safety and health rights implemented at the jobs that they're coming and taking and given access to. And so I think often like when there's the opportunity to like join a collective that's like giving education, you hear about people who are like trained in OSHA rules and then start like training their colleagues in these rules, and then there's that ability to like to give back and to be empowered with the information. I think that's like such a widespread need. The workers, you guys have found like there's so many of them, but there's like not enough of them. Yeah,
and I think that what we heard from when we interviewed workers is these issues of trauma and isolation and loneliness, when that worker centers fill that void. And I think every worker center that I visited, I heard at least one worker say, this is my family. This is not replacing their family, but you feel like family when you're with people who have that shared experience and are working to make a better life for their families who often are not here in the States.
Yeah, they're a major source of, I think, like dignity, of connection, and purpose even. And now, Nora, I will hand this off to you. Thank you so much, Jane and Celeste.
Oh, thank you, Miriam. Thank you so much.
Thanks to all of you, to Celeste, Jane, and Miriam. I found that really enlightening, and your book and your work are very interesting. So thank you for being here today. And thank you to everyone who's in attendance. Yes, this is the book. I got a copy at my public library. So
awesome. Yeah, I heard a woman from Alaska. She sent me just a random email, and she's like, I got your book through our library in Alaska, Petersburg, Alaska. I'm like, wow, that's awesome. I love librarians.
So, because I know that some of you are probably heading off to other things at the top of the hour, I just want to say that we're going to put a link in the chat for all of you who want to get an MLA CE credit, and you can just follow that. You can follow that link to fill out the evaluation and get your CE credit. So thank you again to everyone for being here. I do want to mention also, just a moment, that NLM has some more upcoming webinars and classes. So if you're interested in coming to more of our webinars, here are just a few of them about grants, podcasts, trauma-informed librarianship, elder justice. You can go to the link there at the bottom to see a full list of our upcoming classes. Thank you, everybody, for being here.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.